So the other day, I sent out this tweet in regards to the coronavirus lockdown. I'm going to start regular reminders that every day this continues, the number of people who commit suicide because of it will increase. The number of people who become addicted or OD increases. The number of domestic violence cases increases. How many are acceptable to you? And I would really like an answer to this question. I would really like an answer to this question from the left, who keeps screaming about the fact that we really shouldn't worry about shutting down the economy because who really cares if people are dying? We need to save every single life possible, and if that means shutting down the economy and people losing their jobs, well, you just suck it up because all you need to do is sit around and watch Netflix. I would really like an answer to how many deaths are acceptable to you, people on the left. And thank God people like me have been screaming about this for a while now because, listen, man, we're actually starting to see people write about it. Oh my God, the next COVID crisis could be a wave of suicides. This is from Bloomberg News. Isolation and anxiety are a recipe for substance abuse and mental illness. A new study predicts 75,000 deaths of despair. And we're going to talk about this. We're going to talk about this new data and what I think it means. But before we do that, I have to do the blatant plug for my channel, guys. Listen, I'm really trying to grow the channel. I'm doing my best to provide content I think you'll find interesting, or at least that I like talking about. So you can help me out by hitting subscribe, giving it a thumbs up, leaving a comment, all those things. If you have the means and the inclination, you can also make a monthly gift to support me on Subscribestar. And one of the perks, if you support me on Subscribestar, is you get a shout out in one of my videos. And today, I have not one, not two, not three, not four, but 5 shout outs to give to 5 new members. Thank you to Ricardo, to Banjo, to Wendy, to Jen, and to Leia. Thank you, thank you, thank you. I'm incredibly grateful for your support. I couldn't do it without you. And one more thing. So another perk that my Subscribestar and also my PayPal contributors are going to have coming to them is I'm launching very soon a community on locals.com, which is Dave Rubin's platform. I'm super excited about it. I've got so many cool things planned, and people who financially support me are going to be my beta testers. You're going to be my beta testers. You're going to help me shape the community so it's something that we can all enjoy. So looking forward to that. All right, let's read this article. The isolation, grief, and economic hardship related to COVID-19 are creating a mental health crisis in the U.S. that researchers warn could make the already rising suicide rate worse. A study released on Friday tried to quantify the toll. The paper, which was not peer-reviewed, we're going to talk about that in a second, found that over a decade, as many as 75,000 additional people could die from deaths of despair as a result of the coronavirus crisis, a term that refers to suicides and substance abuse. The research was done by the Wellbeing Trust and researchers affiliated with the American Academy of Family Physicians. And let's talk about the peer-reviewed thing for a second. Listen, peer review is considered the gold standard in academic research. However, just because a study is not peer-reviewed does not mean it's bad. And just because a study is peer-reviewed does not mean it's good. Think about the grievance studies. If you haven't heard about the grievance studies, just Google it. You'll get lots of stuff. But essentially, a group of researchers made up these studies. They just made stuff up, invented it out of thin air, wrote up papers, submitted them to SJW journals, and a lot of them got published. A lot of them did, and a lot of them got peer-reviewed feedback, and one of them even won an award. So just because something is peer-reviewed does not make it good, and just because something is not peer-reviewed does not make it bad. In fact, a lot of peer-reviewed research, it lays a foundation for new research to spring of it. It asks questions, it provides a framework for us to think about, so it's not necessarily bad just because it's not peer-reviewed. I hope in 10 years people look back and say, wow, they way overestimated it, says John Westfeld, director of the Robert Graham Center for Policy Studies in Family Medicine and Primary Care. I hope so too, John. Even as the American economy rebounded after the last recession, suicides and overdoses cut into America's life expectancy. Mental health experts worry about the economic uncertainty and social isolation the pandemic will make things worse at a time when the healthcare system is already overwhelmed. Now, I take issue with that last point. I don't think the healthcare system is overwhelmed right now. In fact, in my state of New Hampshire, thousands of people have been laid off from hospitals because they don't have work. They don't have patients. And this is, I actually had State Representative Bob Green on this channel the other day, and we were talking about how this is creating big problems for local healthcare providers in rural communities, where these local healthcare systems, these local hospitals that are under-resourced, understaffed to begin with, now they don't have patients, they don't have any income coming in. They're talking about how many of these things are going to close, leaving these local rural communities like completely underserved. It is a very real thing to say that this crisis could have long-term ramifications for these smaller, local, critically important healthcare systems that serve these vulnerable communities that typically don't have the resources, the staff, all those things that they're going to close because they can't treat patients for other things. The suicide rate for the U.S. has been rising for 2 decades, and in 2018 hit its highest level since 1941, according to a viewpoint published in the JAMA Psychiatry in April called Suicide, Mortality, and the Coronavirus Disease 2019, A Perfect Storm. Author Mark Rieger argued, and this is a really important point, social distancing could hamper suicide prevention efforts, and said ensuring that doesn't happen is a national public health priority. Ensuring this doesn't hamper suicide prevention efforts should be a national health priority. This is not just something like, oh, the economy, you just care about the economy, oh my God. No, stop it. Stop it. These things are important. There's a paradox, says Jeffrey Reynolds, president of the Long Island-based nonprofit social services agency, the Family and Children's Association. Social isolation protects us from a contagious, life-threatening virus, but at the same time, it puts people at risk for things that are bigger killers in the United States: suicide, overdose, and diseases related to alcohol abuse. Since the middle of March, the number of people filing for unemployment benefits has reached around 33 million people. Americans' life satisfaction has eroded rapidly throughout the same period, according to a poll released Friday by Gallup. And Gallup, say what you will, Gallup is a good polling association. These are numbers that you can trust. Let's see what they had to say. The percentage of U.S. adults who are very optimistic with their current lives and optimistic about the future outlook has dropped to a low not seen since November 2018 during the Great Recession, showed an analysis of more than 4,000 surveys. 4,000 surveys. That is a very, very large data set to be collecting this data from. One of the main things people should take away from this paper is that employment matters. Thank you. Thank you. What have I been screaming about for the last month? A job is not just about collecting a paycheck. It's not just being able to put food on the table. A job gives someone a sense of purpose. It gives something to focus your energy onto. It's kind of like when, if you lose a loved one, a lot of people tend to, right after the death of a loved one, they focus on work because it allows a nice distraction, allows them something positive they can focus their energy on so they don't get sad, so they don't get depressed. It is the same thing here. A job gives you a place to focus your energy. It makes you feel productive. It makes you feel accomplished. When you have a good day's work and you accomplish your goals, you don't feel good just because you got a paycheck for that day. That is an intrinsically motivating thing that has nothing to do with compensation. This came from Benjamin Miller, Chief Strategy Officer at the Wellbeing Trust and a clinical psychologist who worked on the paper. It matters for our economic livelihood and for our mental and emotional well-being. The financial uncertainty caused by the coronavirus pandemic, coupled with a pervasive sense of isolation exacerbated by the stay-at-home orders, makes this movement unprecedented, different from any other economic downturn in recent history, and thus potentially difficult to model based on past events. Okay, so what they're saying here is, look, our model might be wrong. They're acknowledging that. That's an important thing. And this is why I tend to trust this type of research, because they're offering what they should be. They're saying our model might be wrong because we haven't been through this before. That's what quality academic research does. It doesn't say this is the end all be all. It tells you about the assumptions that it made. It acknowledges where the study could be wrong. That's when you know you're looking at a good piece of research. It's useful to have a wake-up call, says Ken Duckworth, Chief Medical Officer at the National Alliance on Mental Illness. Unemployment is going to have a very important impact on deaths of despair. So in other words, these things are related. When people lose their job, when the economy crashes, Democrats, that has an impact on deaths of despair. Already, data showing lower income Americans are more impacted by coronavirus-related stress than their wealthier counterparts. A Kaiser Family Foundation study showed that 26% of people making less than $40,000 a year said the virus had a major negative impact on their mental health. Only 14% of people making $90,000 a year or more said the same held true for them. And I'm going to make this last point because we've seen the social justice nonsense kind of creeping back in where they're like, if you want to end the lockdown, you're racist because Black communities and people of color are disproportionately affected. I've seen that all over the dang place lately. We knew they were going to get racism into it somewhere. But what they're missing is that this is not a question of race. This is not a question of race. This is not a question of gender. This is not a question of marginalized status. This is a question of economy. That's what it is. What financial resources do you have available to you? So a person of color who is wealthy is going to have a very different experience in this than a person of color who is not wealthy. A white person who is wealthy is going to have a very different experience in this than a white person who is not wealthy. And no, not all white people are wealthy, Bernie Sanders. I mean, he actually said that in one of the debates. He basically said, if white people don't understand poor people. I think that was the line, right? Well, there are poor white people too, Bernie. This is not an issue of race. This is an issue of the financial resources that you have available. Do you have a safety net? Do you have a cushion? That sort of thing. People who have that safety net, have that cushion, are still keeping their jobs, are still collecting a paycheck. They are having a different experience than people who probably didn't have that cushion in the first place, and now on top of that have been laid off from their job and don't know when it's coming back. Those are two different things. But you know what? Donald Trump delivered us a gift. You know what? I was thinking the other day, I was like, why doesn't Trump just reverse psychology this whole thing and start talking about how he is not responsible for it, so that the media goes, yes, you are responsible for the economic downturn and mental health impacts of Donald Trump, because at least then we get them to focus on it. And Donald Trump, like a genius, I'm not insinuating that he did this on purpose. I don't think he did this on purpose. I just think this was a glorious accident. But he came out and said today, in relation to the jobs reports and really high unemployment, he came out and said, well, not even the Democrats are blaming me for the jobs reports. So what happens? What happens when Donald Trump says, the Democrats aren't blaming me? They go ahead and blame him. There's a trend on Twitter right now, even the Democrats. And when I clicked onto it, the very first thing I saw was this tweet from Christina Wilkie, who is covering the White House for CNBC. She says, Trump did not express any sympathy or concern for the 20.5 million people who lost their jobs last month. Only concern for who will be blamed. Oh, really, Christina? That's actually not what he did at all. But isn't it funny? Isn't it funny how for the last several weeks, people like me have been screaming about the mental health impact of this lockdown, and people like Christina here have been saying, you just want to kill grandma and get a haircut, and that's the only reason why you care about it, and we don't care about the economy. If it saves one life to shut down the entire economy, it's worth it. That's what they've been saying, right? But all of a sudden Trump comes out, I was like, it's not my fault. They're like, yes, it is Trump. So, you know what? Sometimes you can't care so much about how you got there. You have to celebrate how you got there. And I gotta admit, I was a little pissed when I saw this morning, and I sent out a tweet basically telling Christina and people like her to go F themselves, because people like me have been talking about this for a while. And then I sat back and I reflected and I said, you know what? Let's not worry about how we got to this place. Let's just celebrate the fact that it seems as though the media might actually start covering the mental health impact of the GD lockdowns. So, you don't get bragging rights, but I'll give Trump credit for this one. I will, because if that was purposeful, man, he did a good job. And if it wasn't, I don't really care, because it gets at something that is critically important, that has not been taken seriously by the left, not been taken seriously by the media, but people like me have been going blue in the damn face, screaming about for weeks. Whatever, man. All right, that's all I got for this video, but listen, like for those of you who are my knitters, because I do really have a lot of people who are interested in the knitting that I wear on these videos, and I've got a special one for you today. So if you're not interested in the knitting, the video's over. Like, we're just gonna talk about knitting for a second now, but if you are interested and you want to learn about this shawl that I'm wearing, it's actually kind of a funny story. So I knit mostly designs from Stephen West. Okay, he is my go-to designer. I really like his work. It's fun, it's interesting, he puts it together in a good way. So I really like him the best, West Knits. Today is actually the start of the West Knits Yarn Along, which basically, if you like a designer, sometimes they do these mystery things where you sign up for a yarn along, you know you're gonna get beautiful yarn, you know you're gonna get cool patterns, but you don't know what they look like. You buy into it partially for the surprise, right? So today is the start of the West Knits Yarn Along, and I actually I'll show you what we're knitting right now. We're knitting this shawl. I'm knitting the purple version. I actually already have it on my needles. I casted it on this morning as soon as I got the pattern. Yay! I'm really excited about it. So that's what I'm working on right now. But this shawl that I'm wearing was from the first West Knits Yarn Along that I did 2 years ago. And this shawl, it's called the Deco Drape. That's not what I call it. I call it the 3 Dicks shawl. I do, because it has 3 dicks on it. Stephen West literally told us all to knit a shawl with 3 dicks on it, and we did it, and we didn't question it. And there was actually one woman in the group, she actually, at the bottom here, she actually made this into more of a point, so it was like more like a fish design. But I'll tell you what, it looked like a, shall we say, more feminine version of the 3 Dicks shawl. And this is supposed to be like Art Deco, right? This is supposed to be like the Chrysler Building. I get what he was going with it, but like, the shawl has 3 dicks on it. It really does. But it looks cute, and I kind of try to cover up the dicks, and the yarn is beautiful, as it always is. But that's what I'm wearing today. Yeah, it's Friday. What can I say?